Hello everyone, welcome back to the YouTube handle of UD Academy. I am Dr. Dipankar. I am co-founder of UD Academy, and today we're gonna discuss about the epidemiology, okay, and the role of various scientists and important personnels in public health, okay, how their contributions have shaped the epidemiology and the public health aspect of various diseases. Okay, so let's start. The epidemiological detective story. So, before a long time ago, what we used to think is that diseases are caused due to miasma. Miasma is also known as bad air. Of course, this belief was very incorrect, and now we know that it was not miasma or any bad air that used to cause the diseases. There are various other factors that lead to disease causation. Now, we will talk about some important personalities of public health. So, let's go through them one by one and talk about their contribution to the field of public health. First one is James Lind. If we talk about James Lind, what he did was he conducted the first ever clinical trial. Okay, this clinical trial was also known as scurvy trial. What he did was he conducted an experiment over 12 pairs of British naval officers. So one group was given the citrus fruits, two oranges and a lemon a day. Okay, and the other group was not given citrus food or citrus fruits along with the normal food. So basically, two groups were there. One group was given the citrus fruits, and one group was not given the citrus fruits. So the group that was not given the citrus fruits developed the vitamin C deficiency that led to scurvy. Okay, so this was one clinical trial that was conducted by the James Lind, and after this clinical trial, we came to know about vitamin C deficiency that led to scurvy. Okay, you can read about other aspects of that trial over the slide. Now, second, let's talk about the Edward Jenner, very important personality of public health. So, he basically invented the vaccine of smallpox. Okay, smallpox was the first vaccine known to humankind. Okay, on 14th of May 1796, what he did was he inoculated James Phillips. Okay, he was an 8-year-old boy, James Phillips. What he did was he scraped the pus from cowpox blisters on the hands of Sarah Nelms. Okay, this was a lady who was suffering from cowpox. So basically, he scraped the cowpox blisters from Sarah Nels, and he inoculated James Philip. Okay, he also coined the term vaccination, and now he is known as father of immunology. So, of course, we all know that this was one of the most important discovery known to humankind. We were able to eradicate the disease smallpox because of the vaccination, and this was whole credited to Edward Jenner. Third one is Ignaz Semmelweis. Okay, he was also known as the saviors of mothers in 1847. Why? What he observed was there were various doctors who were taking care of postnatal care of the pregnant females. Okay, so there were two types of groups. In one group, the doctors who used to perform an autopsy, post-autopsy, they never used to wash their hands and directly they perform the task of postnatal care. And one group was there that in which a group of doctors always washed their hands before touching postnatal mothers. Okay, so the group of doctors who doesn't used to wash their hands, their mothers lead to puerperal sepsis or childbed fever. But the group of doctors who used to wash their hands before going for postnatal care of mothers, they the mortality rates were much lesser as compared to the other group. So he basically published a book on etiology, concept, and prophylaxis of childbed fever. So in modern times, we know the importance of hand washing, but he in 1847 basically demonstrated the what is the importance of hand washing. Next is Edwin Chadwick. Okay, he was the first personality to do research on sanitation, and his report, The Sanitary Condition of Laboring Population, which was published in 1843 basically, it led to enactment of Public Health Act 1848 in England, London. Okay, so what he did survey was that diseases and death rates are linked to overcrowding, poor living conditions, and lack of sanitation and clean water in London. Okay, and because of his report, public health reforms were taken about the sewer systems, clean water access, and improved environment. The next one, we all know about him, John Snow, and the ghost map of London in 1854. Now, if we talk about John Snow is also known as father of modern epidemiology. What he did was he discovered the mode of transmission of cholera, and this discovery was a result of a natural experiment. He's also known as basically he's also known for shoe leather epidemiology. It was a household to household survey. John Snow basically prepared a smart map cholera outbreak in London in 1854. He mapped 13 public wells and all the confirmed cholera deaths in London. On the basis of this mapping, he noted the spatial clustering of cases around one particular water pump that was located on the Broad Street of London. That's why he removed the pump handle from the Broad Street pump, and the outbreak subsided drastically. Okay, and so Jon Snow was one of the most important personality of public health. He is still considered as one of the most important personality of public health. And cholera is known as father of public health. Then Louis Pasteur, we discussed the germ theory of diseases in the previous video as well. Okay, Louis Pasteur also coined the term vaccine. He invented the method of pasteurization. Okay, and he invented the vaccine for rabies and anthrax as well. Okay, so these are few personalities that we should know when we are studying the public health. Okay, I have not spoken about each and everything in detail about these personalities and their contribution, but if you want to study more about them, you can read through the slides that I have prepared for you guys. Okay, now let us study a bit about epidemiology. What does the term epidemiology means? Epi means upon. Demio comes from a term called demos that means people. Okay, and logy means study. Okay, so epidemiology is basically the study of distribution and determinants of health-related states or events in a specified population and the application of this study to control of health problems. Okay, this definition you should know by heart if you are preparing for public health. And this definition or the term epidemiology was given by John M. Last in 1988. Okay, now let's talk about the objectives of epidemiology. If we talk about, I will write down each and every objective of epidemiology. Let's prepare a new slide and then I will write down each and everything. Okay, so if we talk about the objectives of epidemiology, the first objective is to investigate the etiology of disease and modes of transmission of disease. Then, if we talk about the second objective, to determine the extent of disease or let's say disease problems in community. Third, to study the natural history and prognosis of disease. Fourth, to evaluate both existing and new preventive and therapeutic measures and modes of healthcare delivery. And one of the most important is to provide a foundation for developing public policy and regulatory decisions. Okay, now we have already talked about the epidemiological triad: agent, the microorganism that causes the disease, then host, the organism that harbors the disease, and environment, and the external factors that contribute to the disease. Now, this is in a nutshell the aims and objective of disease. We have to describe the distribution of disease, that is, what pattern it follows by age, sex, location. Okay, or better, if we can say it terms of person, suffering, place where it took place, the disease happened, and time when did the disease occurred. Okay, also like we can say it to the PPT, that is person, place, and time distribution. It is a part of descriptive epidemiology. We will talk about various types of epidemiology, one of which is descriptive epidemiology. So, person, place, and time. It contributes to the descriptive epidemiology. Second, we have to identify the etiological factors, or what we can say the determinants of disease. Okay. So in this, basically what we do is we do the hypothesis testing. Okay. Why, how does the disease take place? We The third objective is explain the natural history of disease that we already discussed. Then evaluate the interventions and form a public policy. If we talk about today's epidemiology in action today, there is a disease surveillance going on. We evaluate various health services, chronic disease research we do. So these all things we do. Then the investigation still continues today as well. For an exam point of view, I would like to provide you some more information, which I think you guys should keep in mind when we are talking about the aims and objective of epidemiology, or basically, if you talk about the uses of epidemiology. So let's talk about the uses of epidemiology. If we talk about uses of epidemiology, Major Jerry Morris, he described seven important uses of epidemiology. The first one is to study the historically the rise and fall of disease in population. Historically, rise and fall of disease in population. Second, community diagnosis. Okay, if we talk about community diagnosis, basically what we do is we quantify the health problems. Uh, this helps in laying in priorities in disease control and prevention, and also it serves as benchmark for evaluation of the health services. Okay, then third one is planning and evaluation, in which what we do is we evaluate the working of health services, how the health services are performing. It basically begins with determination of resources, analysis of services, and appraise. The fourth important one is evaluation of individuals' risk and chances. Like in this, we include individuals' one day-to-day decisions, smaller decisions like if quitting the smoking habit, or instead of eating a cheeseburger, preferring salad over the cheeseburger. Okay, they may be influenced knowingly or unknowingly, are based on the epidemiological findings. Then syndrome identification. Basically, we have to identify syndromes in the population, okay, for a clinical phenomenon. Then completing the natural history of disease. In this, what happen is to help complete the clinical picture by including all the cases in proportion, relating clinical disease to the subclinical cases by observing the secular changes in the character of disease and its picture in other countries as well. And seventh one is searching for causes and risk factors. For this, what we do is we basically start with discovery of groups with high and low rates. studying these differences in relation to differences in ways of living, where possible, testing these notions in actual practice among the populations. So these are very important 7 uses of epidemiology. If you are writing your exam for preventive social medicine or community medicine, you should by heart memorize and understand all these uses so as to score good marks in your exam. So that's all for today. Next, we will talk about epidemiology in very much detail and also about the modes of disease transmission. Stay tuned with UD Academy. And if you like this video, if you were able to understand the topic well, please like this video and share with other members. Okay, thank you.